Hey, good evening. Welcome to Wednesday Reading Live. My name is Vandana PS, one of the reading trainers from Neethu's Academy. So, yes, after a small gap, right? How are you guys? Anyway, today I think in this video I'll be discussing a sample question from part B and, as usual, a self prepared material for part A. So, ready? I'll give you 2 minutes for the completion of this sample question from part B because, as you guys know, part B is all about 6 questions. Hmm? And out of the 6 questions, if you guys are asking me what type of question is this, I can say this is a multiple choice question with 3 answer options. For example, a question will be there, 3 options will be there, and a paragraph will be there. That's called a multiple choice question. And we can apply a strategy here that's called elimination method. So before doing the material, I mean this sample question from part B, I'll give you 5 simple steps to do this material, this particular question. So according to that 5 simple steps, you can do the material and tell me what is your answer in the comment box. Clear? And before that, let me know how many of you have joined this live segment. Yes, let me know. Yeah, so the first step is read the question. Okay, so first of all, you can read the question. And the second thing is that underline the keywords from the question. So maximum you can underline 2 to 3 words, not more than that. And you guys are thinking why we cannot underline more than 3 keywords from the question. I can clearly say that if you guys are underlining more than 3 keywords from the question, definitely it will be confusing for you. So that is why I'm clearly emphasizing on the importance of maximum 2 or 3 keywords from the question. Clear? So you can underline keywords from the question. That is the second point. And the third one is that understand the question. So when you understand the question, you will get an idea, okay, how can I answer to this question? So based on the keywords. So understand the question in the sense we have categories of questions in part B and you guys know about that, right? And so according to that category of question, you can understand the question whether it is from the first category, second category or third category. Then understand the question and what we are or why we are reading this question or this particular category. Then connect with your options. And the fourth step is read the options, underline the keywords from the options and read the paragraph. Along with reading the paragraph, we are just moving to the fifth step, that is called elimination. I hope it is clear for you. So please do this 5 simple steps to do part B. I'll give you exactly 2 minutes for the completion of the same. So please do the question, then we will discuss the answer. Here comes the question. All right, welcome back. Good evening once again. Yes, hi Divida, good evening. Anila, good evening. Chaitra, Jilmi, Josna. Yes, Anila, good evening. Good evening, everyone. Anyway, I'll just read the question according to those five simple steps and I'll show you how to apply the method called elimination. In part B as well as in part C, we can apply a strategy or a method that's called elimination, and the majority of my students know what is elimination strategy, right? Yes. And before, let me say something. If you really want to join these, sessions, if you want to really join our academy, please do contact the number mentioned below, and you will get offline classes as well as online classes. So, if you need to join, if you really want to join the segments, please do contact the number below. All right. Yes. Hi, Amrita. Good evening. Yes, Nina. Good evening, Nina. Anyway, I'm going to read the question. So, what is the first step? Read the question. What point does the manual make about the advanced anesthetic machines? See, guys, I'll just clearly show you how you can get 6 out of 6 while you do part B if you guys are following these 5 simple steps. So, what is the second step? Underline the keywords from the question. So, my keywords from the question, which are manual, then advanced, then machines. The third step, understand the question. So I'm going to understand the question. So it is very clearly mentioned in the question which category of question is this. This is from the second category. This is the manual. And let me know in the comment box, what is a manual? Do you guys know what is a manual? Have you heard about manuals? Let me know in the comment box, please. Hi Shelma, good evening. Hi Beulah, good evening. So what is manual? Please let me know in the comment box. If you know what is a manual, please let me know in the comment box. Let me check whether you guys have any idea regarding the manuals. Yes. And what are you reading for in the manual? If it is a manual, then what are you reading for in the manual? I can say you guys are reading for the main idea. For example, I am dealing with a kind of a machine or equipment or device, for example, microscope. I get a manual from the shop owner or from whatever, from the shop regarding this particular instrument or this I was talking about a microscope, right? Yeah, about this microscope. And the microscope manual will contain all the informations about this particular microscope, right? Yes. So the complete information which is given in this manual, it's all about the microscope, how the microscope can be functioned, and what is the speciality of this microscope, how you can properly use this microscope. So likewise, they will mention everything regarding the microscope. So in order to understand which category is mentioned, so for example, in this question very directly they have mentioned the category name, and sometimes they will not mention the category here, right? So with common sense, yeah, I can say so, with our understanding, with common sense, we can identify which category of question is that, and please do read the rest of it and answer to the question. Clear? Yes, yes, Nina. Yes, Meera, we are reading for the main idea. Yes, Beulah. Yes, Nina, it is second category reading for the main idea. Yes, Amrita, second category manual, we are reading for the main idea. Very good, Beulah. We are just reading a manual which gives you informations or instructions regarding a particular equipment, device, instrument, machine, or medicine. So simply I can say there will not be any direct connection with animals or human beings. Okay, I'm not saying that there is no connection. Angana connection illanalla. But as I already mentioned, it is all about this particular device. Clear? And so this is from the second category. This is manual. We are reading for the main idea. And one more thing I'll tell you, which lines are important. If it is in paragraphs, I can say the first 3 sentences are important. No, if it is in a single paragraph, I can say the first 3 sentences are important. If it is in different paragraphs, I can say the first paragraph is important. I hope it is clear for you. Yes, Shelma, it is second category, small booklet, which information about a device, machine, equipment. Very good, Shelma. You have a clear understanding about what is a manual, right? Yes, Nina, it is a booklet, contains information about an equipment, machine, instrument, or a machine. Very good, dear. Excellent. Clear. Okay. So coming to this question. So we understood the question. This is all about a machine. And one more important thing. This is a very specific question. Read advanced anesthetic machine. But the title indicates anesthetic machines. Okay. So when you read a manual, always read the title very carefully because title is very important in the manual. And here in the question very clearly they're asking about latest or advanced machines, but in the title they've mentioned just anesthetic machine. So something is confusing maybe. Hmm? And I'm just connecting with my options. Advanced anesthetic machines, it features a lock that prevents flow of nitrous oxide gas. So my keywords lock, prevents, nitrous oxide gas. It is a single term, right? It is designed to deliver gases to the patient safely without obstruction. So deliver gases obstruction. It includes extra safety feature, so safety feature to supply oxygen to the patients as required. So oxygen. So these are my keywords from the question. And let me know in the comment box if you guys have already read the paragraph and you already done with the elimination method. Let me know in the comment box what is your answer. Yes. Yes, Anila, first three sentences are important. Yes, Nina, there is no direct connection with animals or human beings, right? And one more thing, when I just look into your comment box, I can see a lot of fake messages in your comment box. I mean, in the comment box. And don't just fall for those kind of messages, because I know we are, or you guys are handling with this online platform or online media, and maybe you are looking for a particular academy to join, or you just need a lot of informations about a particular module, for example reading or listening, and maybe you will get a lot of messages from other fake accounts as well. So please be careful about those accounts. If you get these kind of messages, please do immediately report the account and block it. Clear? Yes. Yeah. So these are the keywords from the question. Now I'm going to read the paragraph, and the most important part of part B is that along with reading the paragraph, you should do elimination. That is the important part of part B. If you guys are doing the same, if you guys are reading along with reading, if you're eliminating the options, definitely you can get the correct answer. I'll show you how. So in my mind, I'm just feeding, okay, latest anesthetic machines. The anesthetic machine, no, latest anesthetic machine, I just want to know, right? Is used by anesthesiologist and nurse anesthetist to support the administration of anesthesia. The most common type of anesthetic machine, again, no, latest anesthetic machine, I just want to know, is the continuous flow anesthetic machine, which is designed to provide an accurate and continuous supply of medical gases mixed with an accurate concentration of anesthetic vapor and deliver this to the patient as a safe pressure and flow. In the second option, they have clearly mentioned deliver gases, but it is about anesthetic machine, not about latest machine. So I simply eliminate option B. This is something contradictory to my question. Modern machines incorporate. See, I found my word, keyword here from the question. Modern machine, advanced machine, latest machine. So I just hope that now I will get the correct answer. Okay. Incorporate, which means include a ventilator, suction unit, and patient monitoring devices. So what it includes? There are a ventilator, suction unit, and patient monitoring devices. Pressure gauges are installed on the anesthesia machine to monitor gas pressure. Generally, 25% oxygen is always kept in the circuit, delivered to the patient as a safety feature. See? So what is the extra feature of this machine? It can deliver 25% of oxygen to the patient as a safety feature, and that is the speciality of this machine manual. Main idea, latest machine, advanced machine, modern machine. So I think from that line, maybe my answer is option C. I don't know. There are some more lines, right? The device which ensures this minimum oxygen in the circuit is called a hypoxic guard. Some basic machines. No, my question is not basic machines. My question is all about anesthetic machines. Do not have this feature. So basic machines do not have this extra safety feature of keeping oxygen. And what they have, but have nitrous lock. So simply I can eliminate option A. What? A lock that prevents the flow of nitrous oxide gas. It is not the feature of advanced machine. It is the feature of basic machine. So again, opposite option or contradictory option. Simply I got my answer. See? So that is option C. And this is a, what can I say? A perfect example of your exam material. Alright. So you can do a lot of questions, sample questions like this to get more information about what is part B. So in every day, I mean in the next live sessions also, I'll deal with a sample question from part B. If you guys are participating very well, I can give you more exam model questions like this. And if you need such kind of questions, please do comment it, right? Yes, so I'm gonna check your answers right now. Lot of comments mentioned here. Yes, Anila, it's B. Jisna B. Amrita saying it is B. Nina option B. Agila C. Neethu, it is C. Jilmi, Rose Maria, Jasmine and Shelma saying it is option C. Okay, sorry guys, it's not option B because of that reason. I hope you guys have already seen that. It is option C. So that's all about part B. And if you just want to know more about part B, I mean in a detailed way, you can join the session. I mean you can join our academy. As I already mentioned, the number is given below, so you can contact them. Alright. So now we are moving to the main part of our story, which is we have a self-prepared material for part A as usual, and that is radial head replacement. Okay, so now let's deal with what is part A, how we can score 20 out of 20 in part A within 8 minutes of time. And you know that our exam is 1 hour exam, right? Reading is 1 hour exam. Out of this 1 hour, let's divide this reading module into 3 parts. Actually 2 parts, but I can say 3 parts. Part A, B and C. And for doing part A, the time you will get, which is exactly 15 minutes. Not more than 15 minutes. You cannot take more than 15 minutes. So always think and always set in your mind that I can complete part A within 8 minutes. I will. So likewise, you can set in your mind, okay, njan part A 8 minutes will complete cheyum. I can do that. So definitely if you guys are following the same thing in your mind, feeding it in your mind through this kind of manifestations, definitely you can do part A within 8 minutes. Clear? Yes. And now in current exams, part A and part B is very easy. And part C, it is easy, actually it is easy but little bit tricky. So focus on part A, B as well as part C. So now let's deal with part A in detail. When I deal with part A, I just want to tell you something regarding what is the importance of doing part A and what are the different texts mentioned in part A, how it can be connected with your day-to-day activities in a foreign hospital, as well as how we can score 20 out of 20 in part A within 8 minutes of time. And as well as in this video, in today's material, I just want to tell you what is the importance of underlining keywords. Alright. And still majority of students are not able to underline the keywords properly, and that is the main reason you guys are not getting enough marks in part A. Okay, so don't be overconfident. Namakku overconfidence eppadum varum alle. I know everything. No. Sometimes we don't know. So we cannot predict the situations. Namukku situations predict cheyan pattilla. So always keep it in your mind. Okay, definitely I will follow the instructions as told by my tutor or the trainer. So I'll give you some instructions for doing part A. So you guys can follow that and apply to this material. Clear? Yes. Hi Divya. Good evening Divya. How are you? Yeah. So now coming back to part A. Why we are doing part A? You can take part A as a procedure. Or procedure right ningal think cheya. And your doctor is standing there, and this is your first day in the hospital. And always imagine, and you know the story always, I know that, but still I'm repeating the same thing. And this is your first day in the hospital, you guys are there, patient is waiting there, and doctor is there, and the doctor is asking you to do a procedure or a sample collection. You have no idea how to do the procedure. And if you are a student who cleared OET exam, definitely what you will do, you can take some kind of a copy or a hard copy or soft copy, whatever, and read it very fastly, apply to the patient. That's it. Simple. But if you don't know how to read it, if you have no idea what is fast reading, if you have no idea how to underline the keywords, you cannot do that. First impression is the best impression. You will lose it. So, I am coming to this point that when you do part A, the most important technique which we can apply, which is fast reading technique. And for that, it is a skill. See, reading and listening is actually a skill. Namukku already a skill undu. We have to develop that skill. Only through developing or progressing that skill, you can clear reading or listening. It's not teaching. Clear? And the reading cheyannu parayunnadum, listening cheyannu parayunnadum, idu teaching alla. This is called what? We guys are, in the sense, we tutors or trainers are trying to make your skills little bit more progressive. കുറച്ചും കൂടെ നിങ്ങളുടെ സ്കിൽസ് നമ്മൾ ഡെവലപ്പ് ചെയ്യാനാണ് ശ്രമിക്കുന്നത് അല്ലേ. ഫോർ ദാറ്റ് വി ആർ ഗിവിങ് യു സം ടിപ്സ് ആൻഡ് ടെക്നിക്സ്. And for developing this particular skill called reading, what you can do is, as the name itself indicate, do read. And sometimes we feel like, okay, I don't want to read this because I'm feeling like very sleepy. Why? Because you're not interested. And whatever you guys are interested into, you can look into that. Somebody like to read novels, you can read novels, as well as you can read some kind of, series or something. Then you can see a lot of movies or something, and you can read whatever you want, a magazine or a book, a newspaper is quite dry, I know that, but still you can read that to develop that. And as well as Bible you can read, Mahabharata you can read, Quran you can read. So whatever it is available in English language, you can read whatever you want which is interesting for you. And clearly you can clear this exam if you guys are reading for at least 10 minutes in a day. Clear? Yes. And now that is a one technique which we are applying for fast reading. And plus you can do underlining the keywords. And when you underline the keywords, make sure that, keep it in your mind that these keywords will help me to find out my answer. So likewise, we should underline the keywords. Keywords learn, everything will be in the keywords. If your keywords are not correct, your answer will be wrong. So let's learn how to underline keywords. Let's learn how to do skimming and scanning method. I'll show you within this paragraph. Okay. Yes. All right, Divya. Hi, ma'am. I got B in reading. Thank you so much for your guidance. And you are, I'm so happy to hear that. And you are an inspiration to other students, right? Yes, Divya, you just made it. Congratulations. Anyway. Okay. So, yes. I'll just show you how to do this, right? Yes. Radial head replacement. So, when you read something, read loudly. If you guys are sitting in home, whenever you guys are sitting, just read loudly. Don't just bother about others, okay? Because we know that it's our exam, not others' exam. Okay, മറ്റുള്ളവർ കേട്ടു എന്ന് വിചാരിച്ചിട്ട് എന്താ? No problem. Okay, it is our exam. We are going to write that exam. So we need to increase the skill. നമുക്കാണ് സ്കില്ല് കൂടേണ്ടത് അല്ലേ? So we need to read out loudly. Don't care about others. Nobody is going to give you this exam. Nobody is going to clear this exam for you. It's you. So read it for you. അല്ലേ? നമുക്ക് വേണ്ടിയാണ് നമ്മൾ വായിക്കുന്നത്. Anyway. Or you can read for me. Yeah, whatever. So radial head replacement is a procedure in which a fractured bone in the elbow. So I'm just showing you how to do scanning. നമ്മൾ എങ്ങനെ സ്കാൻ ചെയ്യുന്നു എന്നുള്ളതാണ്. So you can underline the names. Procedure in which a fractured bone in the elbow is removed and replaced with an artificial implant. This procedure is performed to reduce elbow instability, which can cause continuous pain and discomfort. It is the best treatment choice for patients with injuries and are not responding to reduction or internal fixation. The surgery is common. Approximately 1 in 5 traumatic elbow injuries involves radial head fractures. These fractures usually affect women in their 30s. So this is how I am just scanning my words and I'm underlining my words. All right. Radial head fractures comprise 1/3 or 1/3 of the fractures of the elbow. The radial bone supports the elbow. When fractured, it can compromise the stability of the elbow, leading to long-term pain dysfunction and degenerative change. In cases where stabilization of the joint cannot be achieved with reduction or smoothing or internal fixation, radial head replacement is good alternative. And these are my keywords from the first para. So likewise, and I know definitely sometimes you guys will feel like stuck in situation when I can say if there is any tables mentioned. But tables or graphs will be there, diagrams will be there. Sometimes we can stuck. Karanam, they can ask you some mathematical questions regarding or related to these kind of tables or diagrams or graphs. All right. So whatever it is, don't be worried. Just read carefully, underline the keywords. It will be easy. Okay. Yeah. So text B, diagnosis. Diagnosing radial head fractures begins with a physical examination. The doctor will detect signs of a fracture more effectively than X-ray. To formulate an effective treatment plan, doctors assess the size and severity of the fracture and displacement in the bone. Pressure may be applied to the joint to test this joint stability and surrounding tissues. Surgery can be avoided if the pieces of bone in the radial head remain intact. So these are my keywords from that one. Standard radiographic imaging of the elbow and with anterior, posterior, and lateral projections with the radial head capitulum view, modified lateral view, with the tube angled 45 degrees towards the radial head, as described by Greenspan. I'm just underlining the whole both sentence because it's in the bracket. Helps in assessing the severity of the fracture. A CT scan can provide better information about the any concomitant lesions, displacement, and communication of the fracture that may not be evident on standard radiographs. Text to see radial replacement surgery will take place under general anesthesia. Once under anesthesia, the surgeon will make an incision on the outside lateral of the elbow joint. After making the incision, the surgeon will then move the tendons and ligaments out of the way to expose radial head. Once the radial head has been located, the surgeon will remove excise or the damaged bone. Artificial implant consists of the replicate head that is attached to the long metal stem. A hollow hole is then made into the remaining part of the radius, and the metal stem of the artificial implant is placed into hollow space and then fixed cemented into place, either using specialized surgical cement. Another way of fixing the replacement part is you can use an uncemented prosthesis that has a fine mesh of holes on the surface. Over time, the bone will grow into the mesh, anchoring the prosthesis to the bone. Once the artificial parts are fixed into place and hinged ends are put together, the surgeon will check for proper fit and motion, and then incision is closed up using stitches or sutures. These are my keywords from text C. And what about text D? Yes, here comes a diagram. So definitely you can expect 1 or 2 pictorials in a part A. Alright, so a lot of small boxes mentioned, and these small boxes are very important. Alright, yes, so total radial head fractures, which is number 85, patients excluded, it is 13, and eligible patients with a partial radial head fracture and available CT scan, which is 72, refusals 29, then patients included 43, conservative treatment 26, surgical treatment 17, associated injuries number 16, then 10, 14 and 3. So this is how I'm just randomly underlining my keywords and numbers and everything. Alright, so now we are moving to the question answer sessions, and I know you guys have already done this material, and I hope your answers will be correct. So please let me know in the comment box your answers. Will you? Yes. First question. How can we read the question? And question is an important part. If you guys are asking, ma'am, which is the important part in part A, I will say the question. The way you attempt the question, the way you approach the question is important to get 20 out of 20. I'll show you how. So I'm starting with first question. What is the purpose of the standard radiographic imaging? When you read a question or when you read a question, always underline the keywords from the question, and please do keep it in your mind that these keywords will guide you to find out your answer. I'll show you how. Purpose, standard radiographic imaging. So these are my keywords. And where is it mentioned? Let me know in the comment box. And you guys know the instructions and everything, right? I'm not going to repeat that. Yeah, so you can write that particular letter there. So where is it mentioned? Yeah, Bina, you are the first person who commented the answer. Alright, any other answers, guys? Purpose of standard radiographic imaging. So we can just look into where is standard radiographic imaging mentioned, as well as where is the purpose of it mentioned. Yeah, only Bina and Agla, right? Nobody else. What happened? Yes. What about others? Let me know in the comment box what is your answer. Purpose as well as standard radiographic imaging. Yes. Yes, LV, it's B. Any other answers? Okay. So, sorry, Bina, it's not option A. Text A here, it's from B. Answer is B. I'll show you where is it mentioned. In text B, yes, Amrita, very good, it's B. Yes, Chaitra, very good, dear. It's mentioned in text B. So now I'll show you where is it mentioned in text B. As you can see in the second para, standard radiographic imaging of the elbow with anterior, posterior and lateral projections with radial head capitulum view and a modified dash and dash helps in assessing. So what is the purpose of this? Helps in assessing the severity of the fracture. So that means answer is mentioned in B. That's my answer. I hope it's clear. Yes, Shelma, it's B. Second question, characteristics of artificial implant. So my keywords, characteristics, artificial implant. So first, where is artificial implant mentioned? And next, we can identify where the characteristics mentioned of this particular thing. Yeah. What about second question, guys? Where is it mentioned? Characteristics of artificial implant. Yes, very good, Agila. Your answer is correct here, which is mentioned in C. Text is C. I'll show you where is it mentioned in text is C, and I think only Agila got the correct answer. Very good, Agila. Oh, Shelma, you got the same. So in text is C, as you can see here in the third paragraph, artificial implant is mentioned. And then we should find out where the characteristics mean. So what is the characteristic or what are the characteristics? It consists of replicate head that is attached to long metal stem. Hollow hole is then made into the remaining part of the radius, and the metal system. That complete part is all about what are the characteristics of artificial implant, right? So simply you can write there, which is from C. Yes, LV, Sanila, Bina. Yeah, very good, very good. Correct answers. Yes, Amrita, very good, dear. And third one, where is the incision made to access structures during surgery? So my keywords, where, incision, and structures. Let me know in the comment box, please. Sorry, dear Chaitra. Okay. Is it first question, Chaitra? If it is first question, it's not A, dear, it's B. Second is C. What about third one? Yes, Neethu. Yes, Agila. Third one is mentioned in text C. Very good. It is mentioned in text C. And where is it mentioned in text C again? Where is the incision made to access structures during surgery? And in text C, as you can see here, somewhere here. Yeah, here it is mentioned sutures or stitches. The surgeon will check your proper fit and motion, and then incision is closed up using stitches or sutures. So that means answer is mentioned in C again. So you can repeat the letters, right? So C, C. And fourth one, who are more easily exposed to radial head fractures? So my keywords, who, exposed, and radial head fractures. Yes, it is a single term. Yeah. And where is it mentioned, guys? Who are more easily exposed to radial head fractures? I think women. I don't know. Yeah, let me know in the comment box. Fourth one, what is your answer? അതെവിടെ മെൻഷൻ ചെയ്തേക്കുന്നേ? Yes, very good, Agila. Again, you scored. Answer is mentioned in text A. Very clearly here, these fractures commonly affect women in their 30s, commonly, usually affect. See? Answer is mentioned in A. Yes, Bina, LV, Shelma. Very good, very good. Answer is A. Fifth one, reasons to evaluate the magnitude and extent of the fracture. So, reasons, evaluate magnitude. Evaluation, examination, diagnosis. Where is it mentioned? Reasons. Because of these reasons, we are just doing the diagnosis or examinations, evaluations. Where is it mentioned? Yeah. Fifth one, reasons to evaluate the magnitude and extent of the procedure or the fracture. Where is it mentioned? Fifth one. Okay. I think you don't know the answer, right? It's mentioned in text B. B is the, yes, very good, Agila. It's mentioned in text B because text B is all about the diagnosis, how we can evaluate this, how we can diagnose it. Why? Diagnosis radial head fractures begins with a physical examination. The doctor will detect എങ്ങനെ identify the signs of fracture more effectively than an X-ray. So that then you can go for that. So the diagnosis mentioned in B. Sixth one. Yes, LV, Chaitra, Bina, it's mentioned in text B. Sixth one, conditions to undergo radial head replacement procedure. So, conditions, undergo, and procedure. Conditions to undergo. Conditions, which means maybe disease conditions or the situations which you have. Yeah. So, where is it mentioned? Because of these reasons, I am just doing head replacement procedure. Radial head replacement, yeah. Where is it mentioned? Sixth question. Again, Akila, you scored. It is mentioned in text A. Because of what reasons you can go for the surgery? In text A, they have mentioned the surgery is common. Approximately 1 in 5 traumatic elbow injuries involves radial head fractures. So that means answer is mentioned in A. And I'm just jumping to the 7th question, last question from the 1 to 7 set of questions. What is the count of patients with associated injuries post-surgical intervention? So associated injuries as well as count of patients. So I'm just underlining counts as well as associated injuries. And the word associated injuries, count of patients, without even reading, I know which is mentioned in D. Clear? You guys know that, right? So that is in text D. Okay. And now it's time to do 8 to 14 set of questions. I'm not asking your marks right now. I just want to know your marks at the end of the session. Clear? So 8 to 14, short answers. Write in a word or a short phrase. 8th one. What might be the basic age of a woman to be more susceptible to radial head fractures? It's not women. There is a small mistake here. I think maybe a typo or something. It's woman. Okay, age of woman. Yes. What about 8th one, guys? Let me know in the comment box what is your answer. Basic age of a woman. Or you can just strike off the word A and it is correct. Age of women. Yeah. Yes. So what is it? Very good. 30s. Age of 30. So answer is 30s, or you can write 30. Both are correct. Okay, either you write 30s in words or you can write in figures. Both are correct. Very good, LV. Yes, Akhila. Yes, Bina, which is mentioned in text A. The same line. See, in their 30s. So answer is 30s from text A. 9th one. What proportion of elbow fractures constitutes radial head fractures? So my keywords: proportion, elbow fractures. What is the proportion? Where is the proportion mentioned? The only proportion which I have seen, which is I think 1/3 or something, right? Yes, Beulah. 30s. Yes, Shelma, 30s. So what about 9th one? What proportion of elbow fractures? Yes, it's 1/3. Answer is 1/3. Exactly mentioned, I think, again in text A. Radial fractures comprise 1/3 of fractures of the elbow. So that answer is 1/3. Then 10th one. Which assessment method surpasses radiography in its inability to discern current lesions, displacement, comminution of the fracture? I've seen this word somewhere. I think in text B, right? Yeah. Somewhere in text B, I've seen this kind of words: concomitant lesions, displacement, and comminution. Comminution. Yeah, comminution. Then, yeah. So, what is the answer? Very good. A CT scan. So, answer is A, CT scan. Okay. A CT scan from text B. Very good. Yes, LV, Beulah. Yes, Bina, Akila. It is a CT scan. And 11th one. What other therapeutic modality did patients receive aside from surgical procedures? What other therapeutic modality? Surgical procedure allade. Other than surgical procedure, what is another therapeutic modality mentioned there? Any guess? Other than therapeutic modality did patients receive aside from surgical procedures? Is it internal fixation? Is it CT scan? 11th question. Another surgical or therapeutic modality. Internal fixation ano? Where is it mentioned? Internal fixation. Very good, Beulah. Answer is conservative treatment. And exactly mentioned, I guess, in text D. Other than what? Surgical treatment. See? Okay. You can go for conservative treatment. So that answer is conservative treatment. Okay, it's not reduction or internal fixation. It's not that. It is conservative treatment. Conservative treatment. Yes. Then 12th one. What is employed for securing the replacement component in an alternative manner? Employed, replacement, alternative. Yeah. So what about 12th question? What is employed for securing the replacement of component in an alternative manner? What is used for securing replacement? Alternative is, I think it's text C, right? Some kind of methods mentioned here. So what is that? Another way of fixing the replacement part is to use an uncemented prosthesis. So very direct answer. Answer is uncemented prosthesis. Okay, so 12th one answer is uncemented prosthesis from C. Okay. Yes, and 13th one. What can be administered to evaluate joint stability and adjacent tissues? So, administered joint stability tissues. What about 13th one, guys? It's not internal fixation, it is actually conservative treatment, okay? And one of the conservative treatment, okay, you can go for internal fixation. So, that term is conservative treatment or conservative management. Yeah, so what about 13th one? Very good. Yes, Agila. Answer is pressure. Again, a very direct answer, which is mentioned in text B, I guess. Again, yeah, in text B, very clearly mentioned where pressure may be applied to the joint to test joint stability. Keyword. Tissues. Keyword. So, answer is pressure. So, that answer is pressure. 14th one. What are utilized to seal the incision at the culmination of the procedure? So, utilized, seal, culmination. What about 14th one? To seal that, yeah, without even thinking, I think it's stitches, right? Stitches or sutures, but I don't know where is it mentioned. I've seen that words. You can use stitches or sutures. Yeah, here. See? The surgeon will check for proper fit and motion, and then the incision is closed up, seal using stitches or sutures. So, very direct answer, stitches or sutures. Alright, then 15th one. Yes, very good. Either you can write stitches or you can write sutures or you can write both. No problem. 15. Out of the eligible patients with partial radial features, head fractures, dash of them declined to undergo treatment. How many of them are refusing to undergo decline, which means they are not ready to do? They are just refusing to do the treatment. And I think it's mentioned in text D. And what is the number of patients who are just refusing? Yes, refusal patients number is mentioned in here, which is 29. A very direct answer. So that answer is 29 from D. 16th one, if the bone fragments, and one more thing, see, I'm just writing these text here on the side of the question just to get you know. നിങ്ങൾക്ക് അറിയാൻ വേണ്ടിയാണ് ഞാൻ ആക്ച്വലി ഈ ടെക്സ്റ്റിൻ്റെ പേര് ഇവിടെ മെൻഷൻ ചെയ്യുന്നത്. യു ഡോണ്ട് ഹാവ് ടു റൈറ്റ് ഇൻ യുവർ എക്സാം ദീസ് കൈൻഡ് ഓഫ് ടെക്സ്റ്റ് കൊണ്ട് നിങ്ങൾ ഒരിക്കലും എക്സാമിന് എഴുതി വെക്കരുത്. ജസ്റ്റ് ടു ഗെറ്റ് യു നോ, ഐ എം ജസ്റ്റ് മാർക്കിംഗ് വിച്ച് ടെക്സ്റ്റ് ഇറ്റ് ഇസ്. ഓക്കെ, ഇറ്റ് ഇസ് ഫ്രം 16th one, if the bone fragments in the radial head remain undamaged, dash would be necessary. So, fragments, undamaged, unnecessary. Not necessary, unnecessary. And let me know in the comment box, instead of the word unnecessary, what is the synonym used in the paragraph? Onnu parayamo? Yes, Bina, Beulah, Anna, it is 29. Yes, dear. Yes, Bina, stitches or sutures. Yes, Agila, 29. Yeah, very good. What about 16th one? Again, same question I'm asking. Instead of the word unnecessary, what is another synonym mentioned in the paragraph? Yes. Unnecessary അല്ലെങ്കിൽ undamaged. എന്താണ് കൊടുത്തിരിക്കുന്നത്? What about undamaged? Another word for undamaged in the paragraph? And I think that's mentioned here. And I'll tell you which text also. Yeah, it is in text B. Texting കൂടെ ഞാൻ പറഞ്ഞു തന്നിട്ടുണ്ട്, which is in text B. So let me know, where is it mentioned? Very good. Avoided. That is unnecessary. See? Avoided. Unnecessary. And where is undamaged mentioned? Where is it mentioned in the line? Same line. Surgery can be avoided. Answer is surgery. But my question is, where is undamaged mentioned? Undamaged. Undamaged, which means no idea, right? Yeah, undamaged, which means intact. Intact, remain intact. Intact, which means perfect, not damaged, undamaged. So that is, answer is surgery. Then 17. The procedure aims, yes, very good Anna, very good. It's intact. The procedure that aims to elevate, reduce. Elevate, which means reduce. Mitigating persistent discomfort is radial head replacement. So what is that? Aims to reduce dash. Mitigating persistent discomfort is radial head replacement. Very good. Excellent. Akila, answer is elbow instability. And which is mentioned, I guess it's mentioned in text A, right? Elbow instability. It is mentioned in text A. Yeah, here. The procedure is performed to reduce, elevate elbow instability, which can cause, yeah, answer is elbow instability. And the 18th one, conventional elbow radiography, including anterior, posterior, dash and radial head capitulum view, aids in gauging the fracture severity. So what is the missing word here? 18th one, yes, Beulah, elbow instability, yes, Bina, yes, Agila, yes. And what about 18th? 18th question. And I'll just give you a clue. It's from text B. Let me know the answer, please, in the comment box. Any idea? Very good. It is lateral projections. Okay. Answer is mentioned in text B. Again, it's a very direct answer. Not that much direct. Yeah. But still. And that is mentioned in text B. I think here. Anterior, posterior keyword, lateral projections. So answer is lateral projections with radial. So all other keywords are mentioned there. So answer is lateral projections. And we are just jumping to the second last question. Radial head replacement is the preferred treatment for unresponsive injuries or dash. So what is the missing word there? Yes, Bina, it is lateral projections, dear. Very good. Projection, projections, I don't know. Let me check, okay? Maybe my answer is wrong. Yeah, sorry guys. Your answer is not lateral projection, projections. Okay, because of that S, you missed 1 mark. Yeah. 19. So what is the missing word here? 19. 19th one, actually it is from text A. I think it is mentioned here. Very good, Beulah. It is internal fixation, and I think it's mentioned in somewhere here in text A. I've seen that word here. It is the best treatment choice with patients' injuries not responding to reduction or internal fixation. Yeah. So answer is internal fixation from text A. Internal fixation. Yeah. Then 20. The last question. To access the dash, a medical professional will navigate tendons and ligaments aside through the incision. Again, what is the missing word here? Amrita, lateral spelling. Please be careful about the spelling, okay? And it's not projection there, it is projections, lateral projections. Yes, internal fixation. Yes, Bina. Yes, Anna, it is internal fixation. And what about 20? Question number 20. The last one. It is radial head. Okay, answer is radial head. Very good, Agila. Yes, answer is correct, which is mentioned in text C. And in text C, I'll show you the answer. Where is it mentioned? It is mentioned in here. After making the incision, the surgeon will then remove the tendons and ligaments out of the way to expose radial head. The radial head, you can write that, right? Already da is there. Oh? Yeah, da is there. So that you can write radial head. Yeah. So anyone with 20 out of 20, let me know in the comment box. So that's done with the session. So any doubts regarding this? Or let me know in the comment box what is your marks. Anyone with 20 out of 20 for this part? Or 19 or 18? Yes. So once again, I'm repeating the same thing. We have offline and online classes available. So if you really want to join the sessions, please do contact the number mentioned below. So that's all about today. And stay tuned. Take care. Bye.